Talk about what's happening today.
Absolutely. Thanks, Jessica. So I'm Chalen Jackson, chair of the NABIP Medicare Advisory Group, and I'm in DC today, October 15th, the first day of Medicare Annual Enrollment Period, to continue advocating for you, our members, continue working with stakeholders in the Medicare space to fight the good fight while you are elbow deep in enrollments, working with your clients to make sure that they wake up on January 1st and still have health insurance. Today, myself and a couple members of NABIP staff are going to be over at the Better Medicare Alliance Medicare Leadership Forum, where we're going to be hearing from plan sponsors, advisory services, Dr. Oz. We're going to hear from a lot of folks heavily invested in the Medicare space, where they see the future of the space, where they think things are headed, what the trends are, and how we can solve some of the problems we're running into.
Thank you for being here on day one of AEP.
Absolutely.
That's a significant deal. I know a lot is happening, but the message to me is that we're here and we're going to continue to be here. We're going to continue to show up. There's a lot of progress that we still want to see made.
Yeah.
Key priorities that we have on the table, compensation being one of them, ensuring beneficiaries feel secure and have the support of those who they trust and they consult with that help them navigate the uncertainty and the chaos, the changes in plans and networks. And that is all of you who we rely on, who our country relies on to make sure that our most vulnerable, our seniors, those over 65, have the support that they need. And being in the room with Dr. Oz isn't a bad deal to talk about going to the top.
Yeah, absolutely. I think we're going to have some great opportunities to discuss things with Dr. Oz and some of these other thought leaders in the Medicare space to really promote the overall goal of more stability in the market, stability for clients, stability for agents, stability for everyone in the system to make sure that we can best take care of Medicare beneficiaries with competitive plans that offer them the benefits they need where they need them, plans that allow agents to continue to build long lasting and lucrative careers by helping people in the right way, and plans that allow our rural health systems, our urban health systems to continue to flourish and improve on how they deliver care and how people can access the services they need in ways that are convenient for them.
I'm so glad you mentioned the dynamic components of our healthcare ecosystem and how people are accessing care. Insurance is one, and getting them in the right plan is another. But to be able to help them get to the right side of care, to get the coverage that they need from a prescription perspective, to be able to feel secure when their child or their loved one gets sick, we do that.
Absolutely.
Agents do that.
Every day.
We're the bridge. We cover the gaps that exist in the healthcare system, and there's no one better than all of you. And we're so proud and honored to be here in Washington, D.C., to support you, to have you behind us represented while we're here in the front, making sure that your voice is not only heard, but listened to.